Hi, it's Dr. Landemeyer with Hill Country GYN. I'm here today with my friend Melissa Bentley. She's a community advocate for maternal mental health, and she's going to tell us about some of the resources we have in Austin for maternal mental health. So if you think you may be suffering from postpartum depression, even if your child's about to go to college, it's okay. You can call Melissa and she'll help you.
That's right. So I am a volunteer in Austin with a couple of different organizations. First, Postpartum Support International. I'm a coordinator for PSI, where I help connect moms and family members to help resources within the community. So if you're struggling, feel free to reach out to me. That's what I do. I also am on the board of directors for a local nonprofit called PPHA, which is Pregnancy and Postpartum Health Alliance of Texas. And we provide a provider directory of resources that are throughout the entire greater Austin area that are specifically trained to work with pregnant and postpartum moms. So it's a wonderful resource. I highly recommend checking it out. And then also I run a support group for moms in the South Austin area. It's on Monday nights from 6:30 to 8 p.m. called Mamas for Mamas.
So Melissa, do you have any advice for somebody who may see someone they think may be suffering with some mental health issues? What could a friend or a family member do to help their friend or family member?
Absolutely. It's really important to ask. Ask the mom and find out how she's really doing. A lot of times when moms are pregnant or in the postpartum period, they will put up a facade of everything's fine, everything's great, I've got this. And they don't really let their guard down and share what's really going on. So it's important to kind of take some extra time and just say, how are you doing? How are you sleeping? There's so much focus on the baby that moms often kind of get lost in the shuffle. And it's important also to realize that it may not look like what you expect. You know, people talk a lot about postpartum depression, but it may not be depression. It might be anxiety. It might be kind of symptoms of OCD, of obsessive compulsive disorder, sometimes even PTSD, which is post-traumatic stress disorder. Perhaps there's been an incident in the past that was triggered by pregnancy, childbirth, or even the postpartum. Another thing to keep in mind is that a lot of times we hear about really extreme cases in the news of what we now call postpartum psychosis, but that's really, really rare. Most moms experience more of depression or anxiety, not the full-blown psychosis. And so if you're only looking for, a mom who's having really, really scary thoughts, that you might be missing the moms that are struggling and really could use your help. So talk to her, see what's going on for her, and then also just go ahead and reach out for help and see what is out there. And then I'm happy to kind of talk you through some of that and give you some suggestions on how to maybe make some suggestions for how mom can get the help that she might need.
And how do patients or anyone that wants to get a hold of you, how do they get a hold of you?
They can give me a call. I guess my information is also on some of your handouts, but you can call me at 512-920-3737. You can call or text. And then there's also the website, which is a great resource, and it has my email address on it as well, is pphatx.org.
All right, thanks for your time.
Yeah, absolutely. Thanks for what you do.